Hello, and thank you for joining this 9-minute presentation on physician strategies for improving patient satisfaction. Our speaker is Dr. Tom Scaletta. Tom is an emergency physician at Endeavor Health, past president of the American Academy of Emergency Medicine, and the CEO of Oscura, a healthcare technology company. Tom's goal is to demonstrate why patient experience is a critical element of quality medical care.
Our job as physicians is to achieve optimal outcomes for our patients. Of course, making an accurate diagnosis is a prerequisite for high-quality medical care. Additionally, customizing the workup and treatment plan is essential. The third factor is patient satisfaction. Patient satisfaction can be defined as the patient's perception of quality. A 2012 meta-analysis published in the British Medical Journal showed positive associations between patient experience, patient safety, and clinical effectiveness across many scenarios. Patients who trust their doctors are more likely to adhere to their treatment plan. Trust forms within minutes and enhances compliance and patient outcomes. Trust is the foundation of satisfaction and is built on the 3 C's: compassion, communication, and perceived competence. There are 4 actions that demonstrate compassion. First, be mindful of how the patient's life is affected by their medical situation. Second, respect the patient's autonomy through shared decision-making. And third, be kind and empathetic. What seems like an overwhelming event to the patient may seem trivial to us. For example, imagine a single mom struggling to make ends meet who sustains a right ankle fracture. While a minor injury from our perspective, she realizes she will not be able to work or drive and so cannot transport her children to their activities for a few weeks. Empathy means envisioning her perspective and understanding the implications of her minor injury. And fourth, keep the patient comfortable by meeting basic needs like reducing pain, quenching thirst, and keeping them warm. Communication requires participation from 2 people. Avoid interrupting the patient and listen attentively to their story so they know their concerns were heard. To ensure the patient fully understands their diagnosis and treatment plan, medical jargon must be replaced with clear, understandable terms. Also, body language often communicates more than words. Maintain a relaxed posture and good eye contact. Appear genuinely concerned. Imagine that you are helping a good friend. Provide frequent updates to inform and reassure patients and their families during encounters, procedures, and hospital stays. Not knowing what is going on creates unnecessary anxiety and unmet expectations. While most healthcare professionals possess knowledge and experience, patients may not always perceive them as capable of delivering exemplary care. To convey competence, physicians must demonstrate professionalism through appearance and demeanor. Also, patients can tell if doctors are being careful and thorough, so show attention to detail. Next, it is important to be confident without seeming arrogant. While confidence conveys self-assurance, it must be tempered with humility to avoid coming across as overconfident, which alienates others by projecting superiority, dismissing input, or undervaluing collaboration. Finally, be approachable. The more patients feel like they can ask questions, the better they will understand what they should be doing to help themselves. The Great Communication Program was developed at Endeavor Health and outlines 5 components of great patient interactions. GREAT stands for greet, relate, explain, ask, and thank. Greet means making a solid first impression by knocking before entering a patient's room and introducing yourself by name and role. Smile, make eye contact, and use the patient's preferred name. Relate means building rapport, which reduces anxiety. Whenever possible, sit at the patient's eye level to convey attentiveness and reduce power dynamics. Connect on a personal level by trying to learn more about their current activities and interests. Explain means using plain language when explaining diagnoses, treatments, or procedures. Ask means inviting patients to ask questions and clarify uncertainties. Ask patients to repeat information to ensure they understand. Thank means ending with a positive final impression that leaves patients feeling valued and respected. Thank them for their time and trusting your judgment. The GREAT program is freely shared, and more information is at eehealth.org/great. Healthcare delivery is transitioning from fee-for-service, which focuses on profits, to value-based care, which focuses on patients. Value-based care improves patient satisfaction and subsequently adherence to physician recommendations. The QUEST acronym helps us remember the components of value-based care and stands for quality, utilization, efficiency, satisfaction, and teamwork. Quality is the most important characteristic and is non-negotiable. As healthcare reimbursement continues to shrink while costs rise, judicious utilization is critical. Keep in mind that the most expensive utilization decision in healthcare is often made by emergency physicians, whether to admit a patient to the hospital or not. In addition, ordering advanced radiographs and expensive medications are significant contributing factors. Efficiency focuses on simplifying staff workflows and minimizing patient wait times for laboratory results, radiology tests, and hospital admission. Patient satisfaction is crucial to achieve patient activation, a term that refers to when a patient wants to become more knowledgeable about their diagnosis and motivated to adhere to the treatment plan. Patient satisfaction is a crucial aspect of the balanced scorecard that defines value-based care and should never be an afterthought. Finally, teamwork. Healthcare is a collaborative environment where positive and respectful relationships with our colleagues are crucial to delivering quality care and maintaining our professional well-being. In addition to the business case for achieving patient loyalty, a loyal patient is one who is also more likely to adhere to treatment. The Consumer Assessment of Healthcare Providers and Systems, or CAHPS for short, is a federal government program to assess patient experience and is administered by companies like Press Ganey. Metrics include communication, ease of access, and overall satisfaction. The Net Promoter Score is a common loyalty metric that determines how likely customers will recommend any type of business on a 0 to 10 scale. There are 3 groups of customers: scores of 0 to 6 defined detractors, 7 to 8 passives, and 9 to 10 promoters. The Net Promoter Score is the percentage of promoters minus the percentage of detractors, and the usual goal is a score above 70. Externally benchmarking CAHPS metrics against competitors is misleading in healthcare, as patients judge service quality based on past experiences or word of mouth, and not comparison shopping. Technology can enhance all aspects of value-based care. Smart technology uses advanced automation and artificial intelligence to streamline workflows, improve diagnostics, and customize treatment. For instance, patient engagement platforms can identify well-being or service issues the day after an ambulatory visit to improve patient outcomes and satisfaction. Internal benchmarking tools can track individual staff performance to identify opportunities for improvement and ensure consistently high-quality care. Physician-specific data creates opportunities for publicly praising high performers and coaching underperformers. Also, sharing positive feedback helps staff to renew their passion for healthcare. Without recognition from patients and medical directors, the risk of burnout elevates and negatively impacts professional well-being. To summarize, I recommend 4 main strategies to improve patient satisfaction. First, initiate a unified approach to achieving great service with a communication standard like GREAT. Second, compassionate care, clear communication, and demonstrated competence, the 3 C's, fortify patient trust and loyalty. Third, balance the components of value-based care, quality, utilization, efficiency, satisfaction, and teamwork to optimize value for all stakeholders. And fourth, adopt innovative technology that drives excellence.
We hope you enjoyed this presentation and can incorporate some of these patient satisfaction strategies into your clinical practice. Thank you for watching.